This clinic is important because it's quite unique. It's the only one in Canada that has this type of configuration. When the patient comes here, they will get a full comprehensive evaluation that doesn't just look at the anomaly, but any associated medical conditions, family history, how it's affecting the patient both physically and psychologically, etc. And that type of evaluation is very unique because there aren't a lot of people out in the medical community that have the amount of knowledge that exists here. And they really feel after their first visit that they know so much more about what they have and about what all the options are. About half the patients we see have what we call pectus excavatum, which is a condition where the sternum is depressed. Some people call it funnel chest, is another name for it. So the first major treatment that we offer in the clinic is correction of this through minimally invasive techniques. We can now use bars such as this one, where we bend the bar to a certain curve, and we're able to actually insert this into the patient's chest and push the sternum out. We do it with camera techniques where the scars are tiny and are really buried under the arms. The patients really like the effect because they have an immediate correction of their chest wall. In patients who have mild conditions, we have something called a vacuum bell, where we're trying to bring the sternum out gradually through applications that they can use at home. We have an exercise program that helps other patients improve the topography or appearance of their chest. So that's one major anomaly. A second anomaly is pectus carinatum. This is the opposite, where the sternum is protruding. We have introduced really the most successful bracing technique for this, and many patients have avoided surgery altogether. In some patients who still need surgery, we're introducing for the first time in Canada what we call the reverse NUS, and that's a procedure where we put a bar to push down on the sternum. So we start with a straight bar like this in the operating room, and once the patient's asleep, we actually contour the bar by bending it into a shape that will allow the patient to have their sternum pushed back in, and then we bolt it to the ribs on both sides. And we also see patients with more complex anomalies, and those patients we often collaborate with plastic surgeons to reconstruct their entire chest wall. And all these types of things are only possible through consultations with multiple different specialists and really seeing one patient at a time and deciding on the best course of action. I mean, I think the two hospitals, the Montreal Children's and the Shriners Hospital for Children, they're really complementary. At the Shriners, we have the orthopedic expertise, and at the Children's, we have the expertise of the pediatric general and thoracic surgery, the imaging. So we bring these two together and we're able to give the patient the best care. And here we are 3 years later. When we opened the clinic, we introduced bracing for the first time. Then a year and a half later, we introduced suction cup therapy for pectus excavatum, and now here another year and a half, and we're introducing this new surgery for the very first time, not just here but in the entire country. And that's what these clinics are really supposed to do. It's not just to do the routine and continue to do everything like it's always been done, but to always think what's happening in the rest of the world, what's being innovative in the rest of the world. My satisfaction comes from seeing, number one, that patients are being served, that our numbers are going up, which means we are offering a service that's highly needed, and that we are fulfilling our mandate of not just providing the best care, but providing state-of-the-art care, and also using it to generate research. We're gathering a lot of data that many people don't have. So we're really changing the entire science of chest wall anomalies in collaboration with people around the world who are also very interested in this.